Like other areas of development, such as motor skills and language acquisition, sexual and gender identity development begins from birth and continues through childhood and adolescence. Children learn from their experiences, relationships, connection to community and the world around them more broadly, including natural and adaptive sexualised behaviour or play and exploration with themselves and peers. Unfortunately, some children explore and display sexual behaviours that are outside what would be expected for their developmental stage, and in some instances, they display behaviours that can cause harm to themselves and others. These are called harmful sexual behaviours. Like many other behaviours, harmful sexual behaviours are best understood along a continuum of severity and intensity and impact within each psychosocial stage of development. The Paton and Bromfield model for understanding harmful sexual behaviours uses a layered approach to conceptualise sexual behaviour across a range from developmentally appropriate and developmentally inappropriate through to that which may be considered harmful sexual behaviours, which is inclusive of concerning, very concerning, and serious or extreme sexual behaviours. Along this continuum, practitioners first look to review the behaviour in terms of a child or young person's developmental age and stage, and then with consideration to other layers of contextual information, including persistency and frequency of the behaviour, the emotional experience of the child or young person when the behaviour is displayed, and the dynamic created when another child is involved in the behaviour, specifically with regards to the concepts of respect, mutuality, and consent. Here is how we use this model to determine the overall level of sexual concern. Imagine as we add layers of information to our overall understanding of a child's behaviour. The cog can move from anti-clockwise or clockwise and take the behaviour from being classified as being appropriate right the way through to serious and extreme. The first piece of information we consider is the general description of the behaviour. So looking at the behaviour within the context of the child's physical, psychological, social and cognitive ability, how developmentally appropriate is the behaviour? This sets the baseline for any further adjustments for classifying the behaviour and has the largest impact on our thinking. Let's use an example as we move along to demonstrate how the cogs move as we add the layers of information. Let's take a 12-year-old boy, functioning within an average developmental range for his age. He's displaying masturbating behaviour. Based on this information, we would set the general description to developmentally appropriate behaviour along the continuum. Now, the next layer we consider is the frequency of the behaviour. Is it a one-off behaviour? Does it occur frequently? Has it persisted even when we've tried to support the child to stop or reduce? Is it one of many sexualised behaviours the child is displaying that make up a pattern of behaviour? Although it is a smaller influence on our assessment of the overall level of sexual concern, when coupled with our understanding of the developmental context of the description of general behaviour, it can significantly change our understanding of the behaviour along the continuum. Now back to our example of the boy. Even though the behaviour was initially set as developmentally appropriate level on the continuum, let's say that this behaviour has now been going on for several months and occurs multiple times a day. This level of persistency and frequency that has occurred over time would cause us to be a bit more concerned about the behaviour and influence our overall level of concern to shift from developmentally appropriate into the developmentally inappropriate range. After considering both the general description of the behaviour and making any adjustments for frequency and persistency, we now consider the next layer, which is the emotionality of the behaviour. This can relate to the emotional experience of the child when the behaviour is displayed or when it is uncovered. Is the child happy? Are they relaxed about the behaviour? Are they playful? Or are they distressed, shamed, feel anxious about the behaviour? If other children are involved in the behaviour, then their emotional experience is also an influence in this layer. Let's just say that the young boy's parents notice his increasing masturbation, and one of them has a discussion with him about the behaviour and the frequency with which he is doing it. He expresses that whilst it feels good and he enjoys it, he's starting to worry a little bit too much that he's doing it too often, and he's beginning to feel a bit embarrassed that it's maybe not normal to masturbate so many times a day. In this instance, although this adds another layer of information and can help with how we support the young person in this situation, it isn't going to change our overall level of concern about the behaviour too much. Now we add in the final layer. This is probably the most concerning layer for many people when working with children with sexualised behaviour. The issue of consent, mutuality and respect when there is another child involved. This layer considers things like power differential between the children involved, either with regards to the relationships, age and/or developmental ability, which is often influenced by a child's social and cognitive capacity. This layer can dramatically change our level of concern, particularly where a typical developmentally appropriate behaviour is displayed within the context of an older child and a much younger, more vulnerable child. Let's take the example again and let's add this layer in. Let's just say it's discovered that he's been encouraging his 5-year-old brother to also engage in the masturbating behaviour by giving him lollies in exchange for getting him to watch him masturbate, and also getting him to try out the behaviour himself. This inclusion of the younger brother in the masturbating behaviour is very concerning, as he is significantly older, developmentally more mature, in a position of power in the sibling relationship, and he is also using bribes in the form of lollies to engage his brother in the behaviour. This would certainly increase our level of overall concern of the behaviour from one that was previously a developmentally appropriate behaviour at the beginning to one that is now considered very concerning. Once we have considered all the layers or parts of information, we get a deeper understanding about the overall level of sexual concern of a particular behaviour for a particular child within a certain context. Whilst this layered continuum helps you step your thinking through and give structure to your determination of whether a sexual behaviour is harmful or not, it is critical to remember that children's behaviours are dynamic. They often change over time and in different contexts. You may have to repeat this step-by-step process each time a behaviour occurs or if you notice a change.